Brushing teeth obviously is really important, and the way in which we brush our teeth, there's a lot of ways to do it. How we do it is also really important. So number one, there's a misconception that it's like, oh, I need to get a medium or hard, toothbrush, but we never want to go harder than soft. So always making sure that whatever toothbrush we're buying is soft. Generally, if it's a children's toothbrush, it will be soft, but that's really important. And then as far as the amount of toothpaste, if it's a really young child under 3, you can just put a little smear layer on the tooth. Any child that's older than that, like the size of a pea. So you don't want to overdo the toothpaste. That's not necessary at all. And then when you are brushing, really soft circular motions is really important. So by the gum line is actually where all that plaque generally forms by our teeth. So a lot of patients just kind of do like this little number. But when we're doing that, we're just kind of moving the plaque around as opposed to swooping it. So those soft circular motions really help. The other thing that I see, or kind of mistakes I see with brushing, is that sometimes we only just brush the top of our teeth. So just like that. When really we have to focus, there's essentially 3 surfaces of the tooth. There's the surface that's by the cheek, or in this case, by the lips if we're out front. The chewing surface of the teeth, which is the top of the tooth here, and then the inside of the tooth. So a lot of plaque can also form there. So it can look like we're brushing really good because we get all these teeth here, but then we're missing the back side of the teeth as well. So that would be like what we call the tongue side if it's the bottom teeth, and on the top it would be the palate side. And it's the same thing, just soft circular motions. So always focusing on those areas and going around versus just focusing on one area only is really important.